Well, across the southeast, there are growing health concerns in the communities that were slammed by Hurricane Helene. Many people are reporting limited access to clean water and basic supplies.
In fact, in North Carolina, health officials are buying extra allergy medication and EpiPens for people who are at risk of being stung by swarms of yellow jackets that have surfaced in the wake of catastrophic flooding. That storm also wiped out a critical plant that manufactures IV fluids, leading hospitals there and in other states to conserve their own supplies. NBC News correspondent Antonia Hilton joins us now from Asheville, North Carolina. Antonia, it's good to see you this Friday. I know that you've been speaking to people there on the ground in that community who said they're struggling, but they are trying their best to essentially just save what's left. What does recovery look like today?
Well, Morgan, it is going to be a long road. You know, as you mentioned, water is a major issue here, and that poses a risk to people's health. It makes it hard to cook food because either people here, thousands of people, still don't have water, or if it's coming back, they need to boil it before they can do anything safely with it. But the other challenge is when you're trying to clean up a place like this. I'm in the River Arts District, and you can see tons of people behind me here starting that kind of recovery effort. They're going in, trying to salvage their businesses, their artwork, all kinds of supplies and valuable goods. But they don't have water to do the cleanup process with. So they're moving mud by hand. They're picking up equipment. They've been warned that some of what's inside may, in fact, even be toxic. So they're doing the best they have with some of the supplies they have. But many of the people behind me here, these are not experts in this kind of cleanup. They are the artists, the business owners themselves, doing the best with what they have. Take a listen to a conversation that I had with one of them.
I'm sad for our community. My house was spared, but I know people whose homes were washed away. It's really hard here right now. I feel a lot for my community. I'm glad that I'm safe, and I'm just trying to get around and help with as much as I can.
And, you know, this is just one part of the devastation here. And I also want to give you some additional context. Right behind me here, there were other buildings just as tall as the others behind me that have now, of course, been completely wiped out here. So it just gives you a sense of the level of work that's left here. They're grateful that there are federal workers, thousands of them fanned out here in North Carolina and in all the other affected regions. But this could take months. I mean, it could actually be years, Morgan, before this area feels like what it was once again.
Right. Antonia, I want to point out we do have a QR code on the screen for people who are in a position to help and can help, and they can just scan that code. We know North Carolina officials there say hundreds of people are still not accounted for. How are the conditions now? Have they improved so that rescue workers can get into some of those isolated areas?
They've improved in some areas, Vicki, but I actually had the opportunity to go out on a helicopter with members of the National Guard yesterday to see the challenges that they're facing up close. So this is a well-known mountainous region. So you go up in the helicopter and you look down, but there are extremely thick areas of trees. It's hard to look down at that angle and see who might need saving. And so they're doing the best they can to do that kind of reconnaissance, but it's going to take a long time.
All right, Antonia Hilton live in North Carolina for us. Thank you.
Thanks, Antonia.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.